Good morning. I'm going to ask us to shift gears a little bit, and I'm going to spend some time this morning talking about the context of adolescent and young adult cancer, that context being the developmental and psychological stages and disruptions. My name is Karen Fasciano. I'm a clinical psychologist, and I am the director of the young adult program at Dana-Farber Cancer Institute. So I wanted to spend a brief amount of time with a bird's eye overview of adolescent and young adulthood. What is this life stage? What are the developmental issues? I apologize for many of you in this room who've heard this many times before, but for those of you in the room who are policymakers or for those who are watching this via webcast, I think this is really an important foundation in which to think about the rest of today and tomorrow. I'm also going to talk a little bit about life disruptions in adolescent and young adult cancer. And most importantly, I'm going to talk about the integration of a developmental understanding into AYA oncology care. I couldn't start this presentation without the voice from a patient. This is Lisa's voice. My friends from college and home and my family, this isn't something they've experienced. When you're a young adult, this is a turning point. When you're settling into a career, getting married, having a family, these are all issues that are normal. And then you throw cancer into the mix and you think, what do I do now? They're still getting on with their life. All my friends are buying cars, getting new jobs, and buying houses. I'm at home and my mom is making me toast. You start to feel a little helpless and other people don't understand. So all AYAs exist within a context of their family and also their community at large, and when they're diagnosed with cancer, also the community of medical providers that are working with them. The purpose of this slide is to really give you a visual sense that cancer impacts all of these areas and is a stressor in all of these areas, but also psychological development for this age group, which is has a very rapid psychological developmental process, is also a stressor. So to really think about the rest of what I say today in this context, that psychological development and the impact of cancer are both horizontal stressors. They're impacting both the AYA, the family, and the community at the same time. And when I use the word stressor, I don't mean that it's a negative stressor per se, although we know that there are negative aspects of both of these stressors, but that stressors can also have positive implications also. So as Archie talked about, the range of AYA for the cancer community is quite large, 15 to 39 as defined by the NCI. So, and many developmental theorists and researchers have talked about this age range with many different languages, such as emerging adulthood, young adulthood, adolescence, early adulthood. So for the sense of simplicity, and also because from my clinical experience, it seems to make the most sense, is that I'm going to talk about adolescence, early young adulthood, which is from 18 to mid-20s, and then later young adulthood, mid-20s to 39. There is a progression of development through this period, which is the arrow going to your right. But I also want to point out that during this period, when someone's coping with cancer, there also can be some regression in development. So before I talk specifically about cognitive, social, and emotional development in this population, I want to say a few things. One is that development is impacted by many factors, including education, gender, trauma, race, ethnicity, sexual identity, temperament. All of these things impact development. And that we really don't have a lot of studies on the developmental issues for ethnically diverse populations. I think it's important to point out, because what I will present is really based on sort of studies that have been done on the majority populations. That development is inconsistent across domains for most of us in the AYA years. Some are more developed in social areas, less developed in emotional or cognitive areas, some more cognitively, less socially. So development is not consistent. And especially important for the population of AYAs with cancer is that development is often mediated by emotional arousal, especially cognitive development. So I'm going to briefly go through, I could spend days talking about development in this period, so this really is a bird's eye view. So adolescence, the importance of this slide is that all these issues in cognitive, emotional, and social are things that are beginning during adolescence. They're not necessarily complete, and adolescents have sort of a variety of capacity to deal with these things. So cognitive issues, adolescents do have a capacity for abstract thinking. Again, that's sort of a developing capacity. They have a reasoning ability, which is developing over this period. They are starting to think of things in moral reasoning and understanding things morally, but that's often black or white thinking, that something's either wrong or right. Emotional development, their identity development is starting in all of these areas: sexual, ethnic, values, and goals. Self-esteem is beginning to develop, although quite fragile in these years. Emotional regulation is again beginning to develop, but complicated and intense emotions are often hard to understand and articulate. Adolescents are sensation-seeking and often feel invincible. Social development, they're developing independence from their family of origin, especially their parents. Peer relationships are important, and they're starting to develop an interest in experimentation with their sexuality. If we move into the early young adult years, young adults have more of a capacity for abstract thinking, moving into sort of critical thinking. They're able to think about future consequences of decisions. They're able to have empathy for others. Again, sort of a beginning development of that, which develops more over time. They have more language for their emotional expression and emotional experience. They're more interested in mutual relationships, can appreciate differences of their peers and other people in a different way. They have learned to modulate risky behavior to a certain extent. They're seeking mentors. They are able to hold financial responsibility to a greater level, and they're questioning spiritual and existential issues. In later young adulthood, sort of all those things that I've talked about are many of them are continuing to develop to deeper levels. And also there's an ability for advanced complex thinking, sort of being able to think about complex thinking. They are able to sort of self-evaluate. They have more leadership capacities. They're able to shape rules rather than just follow rules. They have a commitment to work, relationships, and family, often are finding partners, having children of their own. So this is generally the bird's eye view, and this is a sort of a summary of many developmental theorists that I present to you today. So in terms of this age range, and these points I tried to make most relevant to AYAs with cancer, is that it is normal to be self-focused. And as you can see, the developmental range on the left-hand side of this slide is the things I'm saying first are more typical of the adolescents, and the things at the end move down to the 39 later young adult range. To be self-focused, to disagree for the sake of disagreeing, to jump to conclusions, to find fault in the established position, take risks, challenges, and challenge the rules and experiment, need control, seek peer role models, challenge professional boundaries, need identification of emotional responses, want to make a difference, be most concerned about their young children, and feel responsible for work and family. So moving a little bit into the demands of illness or the demands of cancer for this population, if you look at the bottom, I have the demands of the life cycle, which I have just explored. And this is sort of a summary of the demands of the life cycle of this age range, where they're thinking about intimacy, invulnerability, independence, and control. And on the top of this slide, you have the demands of cancer, or the demands of illness, which are often isolation, vulnerability, dependence, and uncertainty. And young adults really are challenged with balancing the demands of the illness and the demands of the life cycle, and often are doing both of those at the same time. As you can see, that these are directly opposing demands, and I think that that's really important take-home message. So life disruptions. If you look at this slide, you say, what isn't disrupted? There are many life disruptions for AYAs with cancer. These are most of the disruptions, and many of these will be explored later on today and tomorrow morning by much more detail with the following presenters in terms of research data that supports some of these, but I'm just giving you an overview of these. So life disruptions for AYAs really have to do with self-esteem, the role of being sick as opposed to being healthy, their body image changes, hair loss, scars, emotions. So in a time where their emotional, their sense of their own emotions can often be complicated and confusing, they're also faced with even more complex emotions. Their trust in their health is disrupted. Their careers in education, financially, often AYAs have disruptions. They're out of work or delay school, have health insurance problems. Family dynamics are disrupted. As using Lisa's voice, she found herself at home with her mother making her toast. Their future plans of having children or other plans that they had in the future that they're not able to do or need to alter. Fertility is a problem for some AYAs, is threatened or lost for some AYAs with cancer. Peer relationships change. Many of the young adults that I work with talk about making new friends and losing old ones. Not all old ones, but some. Health behaviors are disrupted, so young adults often have changes in their sexuality. They have changes in their sexual drive. They also have changes in their health behaviors, such as the inability to exercise when they're sick, or things like alcohol and drug use is altered by the side effects of medication, or just changed by their sense of keeping themselves healthy. So there are many life disruptions. So this is just sort of a nod to say that there has been some research done on these life disruptions, and some are positive and some are negative. And I know later on today we will hear more about the AYA HOPE study, so I'm not going to go into this in detail, but that these disruptions, many of them have negative and positive implications, but we know that we don't want to just lump them all into the negative category. So I want to talk a little bit about family context, and that as well as individual development, families are also developing during this period, and there is a tension often between independence and dependence in the early young adult years, and then as time goes on, there's also a renegotiation of relationships with parents. And often during these years, there's sort of an oscillation of in and out of the family, that young adults sometimes are closer to the family, return back home for periods of time, and then go back out on their own. So there is sort of that. And there's also then a development into experimentation with finding their own partner and developing their own sense of their own new chosen family. So in the context of cancer, families are very important, and family support and cohesiveness is very important to adjustment, and I'd speculate to coping with life disruptions. Higher family functioning is associated with less distress, but often the different perspectives that family members have can contribute to some distress in the moment, as I'm sure all of you in your experience understand in terms of parents' perspectives can sometimes be different than those of the AYA. So again, I'm going to give you Lisa's voice, and this is sort of a kind of a processing of one of her first quote in terms of where she came to later on. Don't compare the beginning of your journey to the middle of someone else's, and don't feel like you are behind on anything or set back, because you haven't taken a step back. You've moved on to a different path. Your life is different now. So I'm going to spend the next few minutes talking about the integration of a developmental understanding into AYA oncology care. The first thing to talk about is that I think we still have a basic discrepancy in terms of where we treat young adult patients. Are they treated best in pediatric settings, adult settings, or some mix of these two settings. And from my perspective, I'm talking about this care in terms of the psychological development and the appropriateness of the care in those, in that way. So I don't think we really know yet, and I think different institutions have their own structure and different systemic struggles with providing age-appropriate and developmentally appropriate care. We do have colleagues in the United Kingdom who have created more hybrid models, and some of us are working on those also, but this is really an ongoing dilemma and is directly related to development. So it's also important to really think about development over the illness continuum, and that there are different developmental issues that tend to sort of raise their head when at different times during the illness. So for instance, during diagnosis, often adolescents and young adults, again, within this large age range, have difficulty comprehending the information and the emotion that's engendered by such a diagnosis. They feel the impact on their normality, on being normal, and can sometimes anticipate disruptions. And often they don't have the skill or information or knowledge to be able to explain their illness, both to themselves and to others, their friends, their young children. So that's challenging for them. During treatment, their coping strategies are challenged because they don't necessarily have developed coping strategies to cope with such a large change. They have discomfort with dependence, and there's a challenge of the balance of illness with the balance of life demands. Post-treatment, they have a less established life for reintegration. So as older patients are reintegrating back into established life, young adult patients are reintegrating into a life that hasn't yet been quite formed. And during end of life, there are many identity formation issues in the face of death in terms of, how do I think about my own identity in the face of my life being short? And how do I think about that in terms of the legacy that might be unfulfilled, or an overwhelming sense of grief that I'm not sure quite how to cope with? So I'm going to talk about 3 different categories that I have labeled in terms of developmentally informed care. And one is responsibility. And really thinking about who is responsible for my care is a big issue for many adolescents and young adults, especially in the earlier age range. Young adolescents and young adults have many questions about this, so do their family members. And I think providers really have the opportunity to assess and promote sort of the young adults' responsibility for their care, but also to help them to define who's responsible and to discuss the responsibility of the family. So this is something that I find in my clinical experience has been very helpful for this population, and really helps as time goes on to have these conversations over and over again. The next issue is information needs, and many adolescents and young adults aren't really sure what they need to know and what kind of information they need to know to help them make decisions. Family members don't understand if that information is the same for them or different for them, and how do they hold different information than the adolescent and young adult. And providers often can be very helpful to help them help by understanding the young adult's cognitive style, where they are cognitively in terms of their development, and to present information in a life context. Also provide places for reliable information and present information in a useful format. And I know later on today we'll have people talking a little bit more about informational needs. So just in conclusion, I wanted to say that development and the experience of cancer are both horizontal stressors. We don't know much about development in ethnically diverse populations, and I know we'll have some speakers talking a little bit more about that and the impact of that on the experience of AYA cancer. The demands of illness and the life cycle can be opposing. Life disruptions can have both positive and negative impact. Family cohesiveness is important to adjustment and to helping with life disruptions. Challenges to providing appropriate treatment settings are ongoing. Unique developmental needs during different illness phases do exist. and patient and family concerns often reflect developmental tasks and life stage. So developmentally appropriate AYA oncology care matters. I couldn't be in Washington without ending with a quote. I was at the FDR Memorial with my family on Saturday, and went back and did a little bit of research about FDR and his illness, and realized that he was diagnosed with polio at age 39. So it is in the upper end of our AYA years, but this is a quote from his wife. Franklin's illness gave him the strength and courage he had not had before. He had to think out the fundamentals of living and learn the greatest of all lessons, infinite patience and never-ending perseverance. Thank you.